All right, let's go. All right, take a pledge of allegiance.
Yes.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, so Stephen McCann,
Present.
Dr. Lim,
Yep.
Jeffrey DePass,
Present.
and Dr. Amber Caddick, present. Mark Kilman,
Present.
Dr. Jennifer Todd,
Here.
Dr. James Turner,
Here.
Dr. Brucken,
Present.
and Joni Weiss.
Here.
All right, did everyone have a chance to look over the minutes from the last meeting? Any questions or concerns on those?
I move their approval of presented.
I second the motion.
All those in favor?
Aye.
Opposed? All right, meeting is approved. Minutes are approved. Robin, do the financial report?
Yes, it's in front of, I have it on page, let me get through it. It's just the colors of the chart of accounts.
Yes. Look for the pie.
Joni, did you want to tell them about the small little ones that we found?
Yeah, the auditor's office reached out to us about a month ago, and there are all these little tiny funds, whether it's leftover money from COVID grants or, just different things. It totals around $10,000. And they were, no rush, but they would like us to find some assessed need and then ask the council to appropriate them. But they were just all so tiny, it would mean nothing to you to have a number on here. And would be more than happy to send that email to all of you to see, but I've reached out to Mike Graylis, and because I know he has a lot of large equipment needs, and then maybe he and Shelby can share with you an idea that they're thinking about implementing.
Any questions about the chart of accounts?
Dr. Burkle?
Not a whole lot to report from my standpoint. Just been kind of following trends from society out there. Not much has changed. COVID hospitalizations, deaths, everything continues to be taking that downturn, and we're not seeing much at our hospital. And as far as severe level of illness per case, thankfully. So haven't heard anything else from other area hospitals of any alarming trends. We're seeing a lot of extended care facilities right now with outbreaks. Again, people are coming in just COVID adjacent, meaning they're just tired and dehydrated. And they get a kidney injury from being on blood pressure meds and not eating and drinking well. But other than that, it's been pretty mundane, so which is good. We'll take that. So I'm probably stepping on toes, but I am going to take a moment just to thank my dear friend, Dr. Turner over here. Today is his last meeting before he sails back to Florida. It's been an absolute pleasure, Jim, all of these years working alongside of you. Thank you so much for your service.
Hurricane? It was ground zero. I left town. And luckily, we didn't have any damage or anything like that.
Yeah. So, I just want to extend that level of thanks just from me to you and on behalf of everybody here. So thank you.
Since you brought it up, I'll go ahead and read a letter, if that's okay, that I'm submitting to the county commissioners and to you two. Dear Vigo County Commissioners, I'd like to thank the Vigo County Commissioners for the honor to have served the citizens of our county as a member of the Vigo County Board of Health for the past 8 years. I've had the pleasure of serving with an outstanding leadership staff, especially Darren Brucken, MD, and as Health Commissioner, and Joni Weiss as Administrator. The department directors and their support staff are on the front lines each day, dedicated to protect the health and wellness of our community. Since I have retired from the active practice of medicine, I would like to respectfully offer my resignation from the Vigo County Board of Health as of December 31st, 2024. I am proud to have been a member of this professional and compassionate team.
Thank you.
All right, thank you. Thank you, Dr. Turner. All right, Jody.
Follow up on that.
I know, I'm like all hearing it.
Well, Still doing work with us, a board member of Insajo, and enjoying that. Got to participate in a couple of CANS, Community Action Network meetings that Amber and Jimmy hosted at the library with community partners to have input on, where we'd like to see HFI funding being applied and make sure that it's in the areas that we assess as most important. Working with the state on how to improve the data tracker for HFI. They hired a company called First Bridge out of Michigan. And we've realized, as I've shared with you before, that the data tracker does not accurately capture what the health departments around the state are doing. Kind of put the cart before the horse. Should have had the data tracker first, that before we had everybody create programming. So I get to work on that. Dr. Caddick and Jimmy and I met with the Terrell Fire, EMS, and EMA. They presented a mobile integrated health program, which looks awesome. If eventually, we could partner with them or act in advisory capacity to get something like that off of the ground. Had our 2025 proposed budget meeting with the budget committee, and it went perfect, except I didn't know I had it the wrong day, and so I was in my gym clothes. And they got to see the uncensored me with ratty hair and no makeup on, but that was okay. But our budget went through just fine, no changes there. Dr. Caddick got to come and shadow the health department. We were also fortunate to have House Representative Tanya Path come to the health department and do the same, and reaching out to Representative Greg Good and seeing if he'd like to come and shadow with us, even if it's a short shadow. But it's always informative to see what the boots on the ground are doing. We have our first medical student, as I shared with you, starting next Monday. So excited about that for a 4-week rotation. And Adam Grossman and I, Adam Grossman, the superintendent for the Parks Department, are presenting at the state's fall leadership conference. And we're going to be talking about healthy communities and parks and recreation and partnering with them in HFI. So it's been a relatively busy quarter.
Any questions for Jen?
What's the timeline on when we'll know more about HFI and what we're gonna do with the funds?
For which funding cycle?
The current, I guess. Because what is the timeline again?
The timeline for the 2025 proposed budget was this past June.
Right. And so what are we gonna do with that grant money? I guess is my question. Or when are we gonna know what we're gonna do with that money?
Well, when we submitted the budget to the state and then to the council, and I shared it with the board, in that budget, with any contracted funds or anything that we're using it on or which core service, there's a description of it, there's a narrative. And so you have the part that's our staff that are hired from it and what they're doing.
Okay.
And then like things like our new environmental health platform, our for Inspect to Go, stuff like that we know are assessing. And then we have our contracted programs that we're doing, whether it's with the Y, the Parks Department, the judges, Chances for Youth School Corporation, First T, but it lines it out and then it goes into, yes.
I didn't see that.
Any questions you have, let me know.
Very good. Yep.
Any other questions for Jen? All right. So now we have some new business. We get to reappoint Dr. Bracken as our health officer. We have extended invitation. He has very graciously said yes, thank goodness. And so, do we need a motion on that? To reappoint him? All right. So
I'll
I'll
redo that.
go for it.
I'm going to reappoint Dr. Bracken for 2 years, 4 years.
4
4
years.
years.
Can we make it 10?
Same salary. Same salary.
Specified that.
I could be previously.
All right. Do I have a second for that?
I second that motion.
All right. All those in favor?
Aye.
Opposed? Yes. All right. Thank you, Dr. Bracken.
Thank you guys. I appreciate, the confidence, and having me. So Dr. Caddick, been some part of this board, one way, shape, or the other since 2001. So can't leave at this point. cut all my IT there. So, I very much appreciate honored.
Thank you so much. All right. Molly, looks like you have some special guests here today.
I do. Do you guys want me to talk about my report first? and then-
do the program part.
Okay, all right. Sam's one of our program participants that was in the jail in the beginning. Now he's in work release, and he's just gonna talk a little bit about what the program's done for him.
Well, basically, I want to start off that I've been fighting addiction for several years. I've been through several programs. They seem not to hit home with me. I don't know what it was about this program. I mean, mainly the compassion and the fight and the ladies, the knowledge that they have with addiction and what they've been through. It just seems like I feel the compassion from them, and that helped me a lot with getting in the program, knowing a lot, learning a lot about the program. I've learned a lot about myself as a human, a lot of it as a man. I've came a long way, and it's really helped me and saved my life.
Congratulations.
Thank you, Sam. Thanks for presenting.
Thank you for coming up here.
This is Gary. I wanted to share something with you real quick before Gary speaks. So when I went in to see Gary, he was in a pretty bad place. Gary had been in jail before, and this time he was facing 33 years plus.
Another level 2.
Another level 2. And so he was in a pretty dark place and no hope, so to
None.
speak. And so I'm gonna go ahead and let him go from there.
Anyway, so I thought I was going to prison for the rest of my life, and I was pretty sure I wouldn't get out. My kids, they were pretty sure too. I got 6 grandbabies, and I didn't want that to happen. And that was a lot of incentive for me to, get sober this time and to stay clean and not fall back into it. But what really did it for me, I think, was when Molly came in jail, hearing her story and knows that she had 11 years clean and to where she's at now compared to, because I've known Molly for years, and where she's at now and knowing she can do it, I know I can do it. I've only been out since June, and I was struggling when I first got out because I started with nothing again. I lost everything again. And since I've been out, I've been doing everything I'm supposed to do, and I'm making $1,500 a week now. Like I'm doing really good, and I haven't thought about using one time. And I think a lot of it's got to do with the boundaries, learning my boundaries. I never knew nothing about boundaries. I'm 54 years old, and once I learned that I could make boundaries on people around me and all that, and find out what my triggers were. I never heard none of that stuff before, ever, my whole life, until I started taking these classes. I took all the classes that they had in there. But yeah, I'm just, you guys shouldn't give up on, there's a lot of people in that jail that really want it, so anyway, that's all I got.
Molly, can I ask a question?
Yes.
How many % of people in jail are due to drugs?
What percent are using in jail?
Yeah. 10%, 20% of people.
What percent are in?
Oh, gosh. I would say
It's
probably
huge.
90% at least.
85, 90%.
I can't, yeah.
If not more.
Yes.
Not everyone in there is probably trying to get sober, but there is a big majority of them. Like, when I was doing classes, yeah, they really want it. They don't know where to, without this right here, they're just going back out and using it.
Yes.
Let me ask you. I'm just curious, because you said you were out in June, so you're a little early still in the process.
Yeah.
And part of the conversation we've had is, what do you need for the next year? Because some of the follow-up is we've had some conversation. What will help you stay on track now that you know Molly's group and some of the things she did?
Our one-on-ones.
How often do we talk?
All the time. I talk to her weekly. I keep in touch with her weekly. She calls me, I call her, let her know I'm doing good. She always asks me if I need anything. You know, I'm not struggling. There's a lot of the people that probably, that, you know, I'm not gonna get what I'm getting one-on-one like that, but people need that. Yeah, they need to know that other people care, you know what I mean? Because if there's nobody out there caring, then they're just.
So I think what she's asking you is what, moving forward, like in the next year, what do you see would be a barrier to you staying sober?
Right. And what he said.
Okay,
Actually,
yeah,
he
yeah.
actually had it too.
So I think that, and with Gary, the last time that he got out, one of his biggest problems was that he was making $8 an hour and he was barely surviving.
Yeah, I fell back into it because I couldn't afford I was on house arrest in 2022. Whenever I went through the Next Step program, completed it, I got certificates for MRT in there. I did all kinds of stuff in there, and I got out and I did good for a whole year. I went to work for a place fixing up houses and stuff, and they was paying me $8 an hour starting out. They moved me up to like $12 an hour after a year being there, and I still wasn't able to pay all my bills plus this house arrest that because I'm still on the bracelet now. But I was struggling really bad. I had to borrow money every month, and it was just getting me nowhere. Well, I took the incentive and went to work one on my lunch break one day, and asked if I could get my CDLs, if somebody could help me, and they helped me get my Class A CDL in there. They got me a grant. So whenever I went down to Ivy Tech to do the training, the people I was working for, they fired me because I left for the 17. It was like 23 days I had to go down there and train and take my test, and they fired me. So I didn't have a job whenever I got done with that. And then about 9 months went by, and I just spiraled out again and ended up back in the drugs again because of that. Couldn't find a job nowhere. The CDL, they wanted some kind of verifiable driving time before they would hire me. I went to I was all over Indeed and all the sites where you put your application. I did everything, and it was a struggle, and I ended up falling off again. And I didn't have help, so.
Thank you for sharing.
Yeah.
You know, addictions are a chronic, lifelong, relapsing disease.
Yes.
That's the nature of addictions. It's relapse. So prevent that relapse and then recidivism. That's what it sounds like you're really doing well.
Yeah. Thank you.
They are, they're doing amazing.
Yeah.
Tell you that right now.
Deputy Prosecutor Rob Roberts told me after our last meeting that we had with the prosecutor's office, the jail, the sheriff, public defender's office, community corrections, that he said, you have the right staff in there doing the right things. This is amazing. And they're starting to consider where people are at in their progress when it comes to sentencing. So
I was gonna wait until I got up here and say that, but I'll go ahead and say it now. But we've already made the connection with the prosecution staff to let them know what step they're on in their MRT, the moral recognition therapy, so that when they go to court, or so they could push their court date out so they're done when they go to court, and so they could potentially release them. And so if they're low level offenses, they're not hanging on to them forever, they're letting them go. And then we could set a plan up for them to come in our office, like we talked about before, once a week, once a month when they're ready and all that kind of stuff. Yeah, it's really cool. Like they're finally
one of the questions I had for the state was the 2016 Indiana Governor's Commission on Addiction plan, and I brought this up to me the other day. They define addiction as a chronic disease, but State Department of Health still views it as trauma. And so until that definition changes or becomes different, it's, there's the chronic disease division and there's the trauma division. So, but ours is through using the word trauma, whether it's childhood, those that are incarcerated, and those in the judicial system.
Thank you both for taking the time to talk. That takes a lot of courage to stand in front of strangers and tell your story. So thank you so much. Any other new business before we go on to old business? All right. So we're going to do our program updates now. Well, we'll have you step back up.
Okay. All right. All right.
Giving you your steps today.
Yes. Okay, so I know we've talked about MRT before. I couldn't remember if I talked to you guys about the steps in MRT and how long it took. Did I talk to you guys about that? And the reason why I want to highlight that is because of our numbers. So that program takes 3 to 6 months specifically. And so when you look at our numbers in the beginning and in the middle, they're higher. And that's because everybody, you know, in the beginning was jumping on board. We had a lot of graduates. So we had 108 people graduate. And then in the middle, it was 150. And I averaged these. And so these numbers are average because they're 3 months, right? The 150 is high. And then we had some go to different counties. So do you understand what I'm saying? So we had some go to different counties, some got released, some went to prison. And so that's why all of those didn't graduate, because they kind of all are dispersed in different ways. And then right now, the total number of participants currently in the program are 58. But MRT, like I said, is 3 to 6 months. It can take up to 6 months. At that point, if it's taken 6 months, we have to reassess and say what's going on here. You know what I mean? Like, we might need to start you back at the beginning. So, and you guys already know about peer coaching. You knew that we were in there doing that. But I brought these with me. So we started a new program in the last couple weeks. I'll give it to you guys and you guys can pass it around. So when we went out to the RISE conference, I talked to the guy who, talked to a guy about these. They had a table with all these set up. And so, you know, we are not therapists, but these interactive journals are a way for us to get our foot in the door with them, to interact with them as a therapist would without having the license. Does that make sense? And so we were able to purchase this program, and the change program is interactive journaling. It's evidence-based, and it is goal-directed, client-centered, and it helps participants modify behavior, as MRT does as well, just in a different way. And it helps them progress through the stages of change. And it is designed under the ASAM criteria, which was really cool, right? Also in there, because we focus on the trauma, that's a big part of what we do. So there's two separate packets. So there's one for men, one for women, trauma and resilience. And they are amazing. So we haven't started those yet. We're working on getting them started, managing their emotions and all the other ones, and then getting them to a point where they can handle dealing with the trauma stuff. Does that make sense? And so I feel like getting them stable enough to where they can really dig into that stuff, because it gets really emotional, and if they're not ready, it could cause more harm than good. So, but I'm super excited about that. And that program itself was designed for the correctional setting, which turned me on to it too, to begin with. So let's see.
Is that a one-time purchase, or is that something you have to?
You just buy the booklets.
So it has like a one-time fee, and then you just buy the booklets. I think it has like a membership fee once a year. Yeah, I don't have the numbers with me, but do you guys have any questions about that?
Do you have any, I use YouTube and like Google, you know. Do you have any YouTube video
On that?
rehab? Yeah, like this?
There is a platform. Us as facilitators have it. I could probably send it to you to give it a look.
That's all right. I'm
Yeah.
just saying for
So-
people to, you know,
Yeah.
sometimes reading, they have deficiency and then.
Oh, you know what?
video,
We don't. I don't
Huh?
think. Yeah.
you
You
know,
mean
video,
instead of them reading? So
Yeah.
I have a couple people in some of my classes, like one girl had a stroke since she's been in jail. And I've worked with her individually. I have to help her write, to do her homework. I help her do her step work and read it out loud because she can't, you know, so we do, you know, help those people adapt in situations like that. But we don't have, you know, tablets or anything for them to use. That would be cool, but We don't at this point.
You're not allowed.
I-
iPad and
right,
laptop
right.
inside.
We're limited going in the jail, so. Yes,
So, most people with addictions have a dual diagnosis.
Yeah.
And often they've medicated that diagnosis. So through this program, did they ever get a clinical diagnosis like mixed anxiety, depressive disorder, bipolar disorder, ADHD, adult ADHD? Do they ever get a clinical diagnosis from anybody?
well, yes,
Like if you saw me or someone, we could give you a clinical diagnosis.
yes, they do.
Okay.
I mean, well, so, Virgil Mackey, he works for the courts.
Virgil and I went to the same high school
Yes.
many years ago.
So, sometimes I'll request that Virgil see someone who's, if they're really struggling, and then he'll give them a diagnosis.
Now, do we ever use medication in the jail or not?
Yes.
Okay.
Yeah,
So the appropriate diagnosis would.
yes,
Appropriate med.
and
With Virgil helping.
yes.
clinician or whoever.
Yeah, so they have one in the jail. So the answer is yes, yeah. Yeah,
What a program.
wow, thank you.
This is
Yeah.
Really,
I get
Very
super excited
comprehensive.
about it. Yeah.
very good. That's
I
great.
agree, this is fantastic. Do we have an idea of the capacity, like where are we at in terms of our resources and what? How high, how much more can we grow this with current staffing?
Well, right now, I mean, we still have room. I feel like, I was just talking to Gary, before we started the meeting. As we went in there, I feel like our numbers have went down because we went in, a lot of people got released and this and that, and new people have came in. When we first went in there, I went to every block and was like, okay, you guys, this is what we're doing. And I think that I need to do that again to get, you know what I mean? But we're not at capacity. I don't know what that
Okay.
would look like exactly, you know, what that number is. We're kind of like, we'll go until we can't.
Yep.
It's how we work. And so, you know what I mean? I mean,
Are you part of the process when they come in to be identified? that
we're
they-
working on getting that taken care of, but yes, I mean,
Come January,
Yeah.
we'll
Is that-
bring an
yeah.
intake coordinator on board.
Yeah.
Cause that's
So-
gonna open that up.
so that
Yeah.
person
And
will,
help with your question.
Right.
so that person will identify all the risks, you know, needs assessments and stuff like that. Housing, mental health, and medications they might need, mental health, they might, you know, all the
Discharge
things.
planning.
Yes,
yes.
That's medical
And so-
terminology.
And one of the things that a barrier that we've been removing too is that whole, and I know that we talked about this before, but I've had some of the guys bring a guy from the block who's not in the program to class and
Yep.
say, hey, they don't have insurance. Could you help them out? And I'm like, yeah, I'll pull the paper out of my backpack and I'll fill it out. I scan it into my phone, send it to my insurance navigator, and they're in rehab that day. Literally.
And trying to create support systems within the block,
Yes,
peer to peer.
yes.
Yeah.
So we
Here
have
comes-
mentors.
Yeah, that's how we got our numbers. The block I was in, any new person that come in, they said, where you guys, Marty, you wanna go?
Yeah.
You know,
Love it.
and Miss Molly's gonna tell you you can't go because we're dragging you to class.
Yeah.
Yeah.
So what we do when someone graduates from MRT, they'll become a mentor, and then they'll come to class and then help others back in the block who don't maybe understand everything. Because MRT is designed, we're facilitators, but it's also designed to get them to read and think and really be driven to work on it themselves. It's not meant for us to stand up there and tell them every single thing to do step by step. It's meant for them to make the change, for them to really, you know, to do it. And so sometimes I go back to the block and don't understand something, you know what I mean? And so it's good to have the mentors because they can say, okay, and help them out a little bit.
I think that's one of the most effective things of AA, actually,
Yes.
is that sponsor thing. And mentor is the same thing. Because people with addictions, you're very selfish. You
Right.
know, I mean, and nobody's ever told you that. It's all about me.
That's what you told me all the time.
You know, so you realize, I can be so selfish. You know, I'll go to the wedding if you better have some damn beer there, I'm not gonna go. You know what I mean? You become so selfish. It's all about me. And I think your program teaches people that it's not.
It's opened our eyes to a lot. Like I said, you know, the selfishness, the greediness, you know, the boundaries and the triggers and, you know, all this, the attitude, you
Stuff we
know,
would have never thought about
stuff we
otherwise.
never would have thought about. Never would have blinked an eye at, you know, but now we, you know, sometimes hold on. I gotta stop somebody, let me. All right, now I can go at it because I was getting ready to go at it a different way, you know, so now really it's helped a lot.
So an example is, and I won't get into grave detail or whatever, but I sent Sam a message the other day and he kind of took it the wrong way or whatever. It wasn't towards me or whatever, but I said, now, is that any way to think? You need to really think about whatever. And he was like, you know what, you're right. And so it's the little things like that, helping you change that thinking. You know what I mean? Sometimes when you live your life in that chaos and in that circle of, you know, drug addiction and just the turmoil and all those things, everything is just so warped that you can't find functionality in it. You know what I mean? And so just those little reminders that that's not really what that was. Just take a deep breath, you know, take a step back.
Persons, places, and things.
Yes,
Definitely.
yeah.
many times do I say that?
All the time.
Don't go in
Places,
without
things.
saying what's because citizens are here.
That's right.
Don't set yourself up. It sounds simple, but
Yeah.
persons, places, and things is just you start.
Yes, a question, Molly.
Yes.
Your program seems to be very successful and working very well. Do you have any intention of additional program on those drug addicts that are not incarcerated, that these people who help you can help them? That's your next stage in your life if you do not rehab or you do not improve. That would be neat. It's like,
So using the people
Preventive.
that we've helped to help. Yes.
it's like
Yes.
We've got a
preventive,
great
you know?
recovery.
We've talked about it. Yeah. Yeah.
That'd be neat.
Yeah.
Your help will be, you know,
Service
proactive.
work,
It's
giving
called
back.
Proactive, yeah.
Yes.
Can we clarify how many positions are with this program right now? 3. And
Two peer
then,
recovery coaches and
Okay.
Molly. And one of the peer recovery coaches this week is going through certification for MRT. And then we'll bring an intake coordinator on in the spring. And then they work in tandem with Virgil Mackey and Janet McBride. And I don't know who, and then the different social workers,
Yes.
like the fellow that's the one for the police department.
Jerem.
so in January, we'll have 4
We'll have 4,
certified
yes.
programs. So just curious in terms of even next
We'll
year.
have to grow, continue to grow it.
I know Molly, you've been around for what, a year?
Not even,
Not been a
not
year.
even
It's
a
amazing
year.
all the progress you've made. Yeah.
Mhm. And one of the things that we try to do at our meetings when we bring everybody to the table is look at what other kinds of data do we need to capture for what would be relevant to the prosecutor's office or relevant to the courts or relevant to us or relevant to the community. But we're always looking like if we can't think of it, then maybe Janet or Virgil has the answer or we get into this, we'll get into these conversations like, well, what can we do about this? And it's just nice to have everybody at the table trying to problem solve and how we could best capture all this to move on, grow it.
It'd be neat to do a time study for you guys.
Right.
I'm just thinking in
Yes.
terms of follow-up and the one-to-ones and truly, like you said, you will work probably till you cannot work anymore,
Yeah.
but that's not what we want.
Right, right. And I get that too. Yeah, I mean, we have to be careful with that because burnout's real.
Because boundaries are important.
Yes.
Yeah, right, yeah. And we do, like, so, I mean, we get off at 4. I've always got my phone, you know, and I do tell the guys and the women, you know, I get off at 4 and weekends are mine, but here's the thing, crises happen, you know what I mean? And I always tell them, listen, if something happens, if it's a true crisis, give me a call. If it's not, you wait till Monday, you know what I mean? And I've only, you know, had a couple calls when it was, you know, not between the 8 to 4 and whatever, but
Yeah.
it's just, you know, life is life. And sometimes they don't have anybody else. And that's that moment that they need, even if it's just somebody to answer a phone, it could be life or death. And so, you guys have any more questions?
I want to say thank you for including that.
You're welcome. That was for you.
I just want to say too, Amber shadowed me one day.
Joni talked about it, yeah.
Yes.
It was cool.
Thank you, guys.
I did, yeah.
Got to go to a rat house, got to go to jail.
I had her down in the trenches.
It was awesome. Hey, Amanda, environmental.
So guys, we continue to be busy, septic installs, replacements. A couple of staff did perform a dye test this past fall on a home that, we had 3 homes in the area. One of them was outletting into the ditch. We didn't know which home, so they sent out the letters. It's a process. I think they finally figured out which one. Okay. As far as I'm just kind of doing some highlights of things that we've done. We have been very busy food-wise. You can see all the events that we've had. So you see those are events that we're gonna be there doing the food trucks and temporary permits. Andrew, Shelley, and Anna took our 5-day lead risk assessor course and the state exam, and they all passed. So now we have 6 staff members that are lead risk assessors, licensed through the state. I had some staff that attended our Indiana Environmental Health Association fall conference. Katie and Amanda Baker went to Savannah, Georgia for a Lead and Healthy Homes conference. And then Shelley and I, and then Amanda and I presented at the District 7 monthly workshop on our body art ordinance. And then again, we did it for the District Indiana Public Health Association through Zoom on our body art ordinance. So those are our highlights. Any questions?
All right, Shelby?
Hi, everyone. To follow up, do a highlight real fast. So we went around to a few assisted living facilities, and instead of preaching to them about, different health education items and factors, I wanted to make it fun for them. So what better way was it to incorporate bingo cards? And they loved it. So we did that, and I have it on a template that I can take and use periodically with different organizations, so I don't have to copy off numerous pages or order different supplies and stuff like that. I was able to secure an amazing sock donation through a actual kind of a local sock distributor, and I can't remember the town that they're based out of, but the company is called 4 Bare Feet. They partner with NFL, MLB, any kind of major landmark place such as national parks that sell products that have to be A, W, 1, 2, 3 number color. It has to be that specific one. If it's not, they can't legally sell it. So they decided to donate it to a couple health departments, and one of them was ours. And I went in my tiny little car and I picked up 1,300 pairs of socks. Don't ask me how I got back here, and I won't tell ISP. But those donations roughly estimated around $20,000. So we'll take these socks. We've already taken them out and distribute them to some veteran groups in our area. They'll go to any unhoused people in our area. Anyone who is giving these out around the community, I partner with them. They can give us a call, and I also take them to my events and hand out too, just to kind of break that barrier of whatever information we're giving out. If they see socks, you can't necessarily correlate them to coming up and getting harm reduction supplies and stuff like that. We have more Narcan, so we have up to 30 doses now. We completed or certified 8 people for first aid, CPR, AED training, and I was also one of them to be recertified to teach. It's crazy to think that my 2-year license was already up, but we are back with that. And we'll be looking in the future at basic life support training, and that's what our EMS and nursing professionals will need. So we'll look into that in the near future and hopefully have that on our next quarterly report. With All Babies, Dads Matter, and the Community Action Network, I was approached by one of their board members, and I will be joining the board in 2025. So it'll be exciting to represent the health department on those committees. And lastly, through Indiana University, I was able to become a trained and certified adult mental health first aid trainer. So I can identify these and kind of do minor work of what Molly's doing at a much smaller scale. But yeah, she inspired me, so I was like, I'm gonna do this. But yeah, very busy and always staying on our toes. I didn't include this, and I'm sure most of you are already aware, but the most recent CDC announcement for respiratory viruses, including COVID, flu, any of those associated illnesses, is to stay home and away from others, obviously until your symptoms have lessened, but most importantly, you're fever-free for 24 hours unmedicated. So we just like to mention that. We sent that out to all of our employees here as a little reminder.
I'm not gonna let her go without.
Dancing with the stars.
Yeah.
It was very exciting and it was a lot of work, and it was a great night. And thank you for everyone coming and supporting that. It was fun. I'd do it all again, maybe.
And Dr. Todd, did you know where the health department or the county employees were sitting in that great big large venue when she went out on the floor?
Oh yeah. Oh, you can hear it. Yeah, you can hear it in the recording.
Yes.
Coroner's office, our office.
Yeah.
Everybody was
Eventually, you'll have to do a reunion, just like the regular Dancing with the Stars. So I might do it in another 10 years. Who knows? Maybe I'll break a leg actually. Huh?
How much did you raise?
So altogether, we did a record-breaking year of raising a little over $400,000, and that is in a 2-month span process.
That is awesome.
It's all for the kids.
Biggest fundraiser in their home.
Yeah.
Nobody's doing that much. Wow.
Yeah, 2 months, 10 dance lessons. It is a lot of work, very fast.
You look like you.
Thank you. Thank you.
Did you get it for them?
I need my boots, not the heels. But yeah, do you guys have any other questions?
The only thing we're asking maybe Mark, if he knows, the Narcan program at Union, they had a machine. I wondered, what's happened with that, or do you know?
Yeah, it's still there and it's being utilized. Yeah, yeah,
So people
yeah, it's being
can
utilized. Yeah.
physically go and.
Yep.
And I always share that as a resource too for our community. But one of the barriers that I see for Union with the vending machine is people can see them going and accessing Narcan, whereas here, there's different entities within the same building. If someone's seeing someone walking in through our doors, they cannot associate them walking out with Narcan or harm reduction supplies.
So there's probably security.
Restate that again, sorry.
So
Where it's tucked
With the
away by the
vending machine?
ED, yeah,
although it's tucked away,
it's still there.
it's still there, it's still public to the eye. Whereas
Okay.
coming into here, you can't associate that someone paying their taxes is coming to get Narcan.
Gotcha.
You can't make that association between the two. They just come out with
Mhm.
it either in the purse, the bag, whatever it may be.
But with the flip side of that, it's become so less stigmatized.
Yes.
Because every family and everybody's car should have it in the glove compartment, and it's just, and that's why we're seeing less, one of the factors I think that we're seeing less overdoses in the United States.
I agree.
And breaking that barrier that even if it is not something that has to do with an opioid, using nasal Narcan does not have any effect on the body if it was not to be an overdose. So, yeah.
It's a very effective medicine.
Yes, it is. Yes, it is. And the good thing about Union is they can access it when we can't access it here. So it's a great partnership. I thank you.
All right, Loretta?
I'm gonna keep Loretta's good one.
Robin?
So Loretta has a new employee. It's Maddie, Madison Lindsay. She's been with us now since April. And so she wasn't here at the last one, so we wanted to introduce her. So I was looking at Loretta's notes, and they're in front of you, and it tells you what about the new births and the deaths, and they're running about the same right now. I think it's slowed down a little bit with the birth certificates because of the kids already back in school. So it's staying, even, and you can see the death. I was reading her death. They're actually about the same. They were July, August was the same, and 7 more or 7 less for September. Any questions? And we gave Dr. Caddick's report that she wanted from Brooke over the death.
We're looking at suicide trends. I know Vermilion County has the highest suicide rate in the state. I was surprised to learn about. We don't. I think we're in the middle.
60.
Yeah, 60-ish, but
Ranking.
60
yes,
out of 90.
as Vermilion County, so I'm just kind of figuring out. Yeah. All right, thank you. All right, Mike, vector control. Your turn.
My season's over with.
Yay.
No more critters for Dr. Bruckman. No more rat houses. We're done with that.
Yeah.
I can give you some year-end totals that we have now. As you've seen in my notes there, we did send in 7 bats for rabies, and they all came back negative, so that's good. But our mosquito control, we sent in 98 pools of mosquitoes for testing for West Nile virus, and we ended up having 12 positive pools this year. So we had some positive pools here in Vigo County. No human West Nile virus, but mosquitoes did test positive. Indiana itself, 91 out of 92 counties had West Nile virus positive pools. Almost the entire state. One county down southwest, and I don't remember the name of the county, but I remember it was southwest part of Indiana, was the only county that did not have West Nile virus positive mosquitoes. They tested 571. They had 571 positive pools, the state of Indiana did, out of the 91 counties. And we had 7 human cases in the state of Indiana. So, literally, as you recall me saying in the last meeting, we're almost 5 inches below normal rainfall. And I am glad the season is over. I'm about ready to shake my head like Dr. Bruckman. It's getting gray, Dr. Yes. Illinois, 69 counties with positive pools. And they had over 3,050 positive pools tests for West Nile virus. So the state of Illinois, once again, a lot higher than the state of Indiana. And they had 52 human cases with 5 deaths. So that's a little bit of numbers for you to kind of compare. But we weren't the only state that was having difficulty with West Nile this year. State of Illinois did as well. Ohio did. Any state that was fighting the drought, which was most of the Midwest here, had West Nile virus. And like I said, I'm glad the season's over with. Tony's already told me now I can go on vacation for the rest of the year. And get paid for it. I thought we had a nice little meeting. Anybody have any questions? And it was a pleasure having Dr. Caddick come. It was a pleasure. And at any time, any of the other board members would like to come up and visit our facility and go around, we'd be more than happy to show you around. I know Dr. Turner has in the past. And Doctor, it's been a pleasure working with you. I'm going to miss you, my friend.
You too, and Mike always, I gave him a book at one time, it's called Mosquitoes. I was this thick. And we all know the most dangerous animal in the world are mosquitoes. From malaria to yellow fever, and it's still out there. Malaria is still the #1 killer of children in Africa. So you have been fighting. You made a career, dedicated yourself to fighting the most dangerous animal in the world.
Well, that's why I quit reporting critters, Dr. Bruckman and his critters. Critters wasn't really important.
We were so lucky to have someone with your expertise and knowledge and your commitment. It's a real, people die from things you help prevent.
Yes.
It's a real thing.
Yeah.
And your dedication has been just wonderful.
Thank you very much.
So we have zero death from West Nile virus in Vigo County? There's nobody infected?
No,
with-
for years, years.
No. No,
But we have positivity of how many?
we had, 12 positive pools.
Yeah, that's what I was
of
gonna
mosquitoes.
ask. Cause you said when I was there that the sewer outlet was one of the positive pools. Where were the others in the?
We actually only had them from 2 other locations.
Okay.
And one of them was from another sewage facility in the county. And one of them came from 2 lagoons up north. And, but it only was for 1 week. So I don't know why we had a positive pool come from there. We had treated those lagoons and I wasn't quite sure why we ended up having positive pools from there. But when we get them from the state, it's like 3 weeks late.
Right.
So once I get them, it's like, okay, that was 3 weeks ago. So you try to react, but you can only do so much, of course. But we try to treat as many of those areas as we possibly can. And that area had already been pre-treated, and Joni had asked me about that actually when I had reported to her that we had positive pools from there. It had already been treated, and it kind of blew me away. But I know that area has a lot of debris because the river comes up, and tin cans, etc. And that's kind of the same thing that we fight down at the sewage drop off. The river comes up and it brings all that debris in, and along the back side of it is nothing but a ditch that goes for about 200 yards. That's full of nothing but trash that the river brings in. And that's where we get our problem at. And there's really not a whole lot we can do about it. Continue to adulticide, of course, and larvicide what we can. But yeah, that's where the other ones came from. Yeah. Any other questions?
And on a side note, with the rat house, we did end up tagging it unfit.
Yeah, Mandy did. So now it's hers. She gets to wear this high-tech suits.
Nice.
Any other questions?
I just kind of thinking proactively as, you know, as milking all the floodwaters we see now. And the backside of getting into more temperate regions, you know, down in the southeast. And I'm not talking about salt water being contained because mosquitoes aren't going to prosper in salt water necessarily, but freshwater all around, you know, the Carolinas and all of the. Just wonder if we're going to see an increase again because they're not getting frost right now.
No.
You know, we got our frost, and every time I get the frost advisory, I think of you. No, I know it.
We talked about it last year a little bit when we had the cases of malaria in Florida, which has not been seen in Florida for like 20-some years. Now you got a setup for if there was some malaria around, and now what you're going to be seeing will be interesting to see. I mean, human case of malaria, they haven't had it in this country. Around the world, it's still endemic. But interesting to see what the next several months come with malaria.
Absolutely. Yeah, all that flood water down there. I'm glad for Dr. Turner that that's where he's now located at. I'm glad I'm not down there.
Mike, answer your question. It's just, what temperature again that all mosquito will be eliminated?
It has to freeze, but they become inactive at 50 degrees.
Inactive at 50.
Yeah. I think they personally become inactive around 60. But professionals say 50.
They are alive, but they don't bite.
Right, correct. Yeah, when we get the first hard freeze, then it will kill them off, except for some of your Culex species, which will overwinter during the adult stage. And they overwinter in your house, your garage, culvert pipes, etc. for next season. But your 80 species and those different species will all die off. Their eggs will be ready to hatch for next year, but Culex are the only thing that overwinters in the adult stage.
The egg don't freeze.
No. Nope. I wish they did.
Good job, maybe.
Thanks, Martin.
Thank you. All right, Chelsea?
Without a microphone, I think. So we're coming into our busy time, so roughly 100 COVID vaccines already. We've got the RSV vaccines in, and we're booked solid for a week and a half, almost 2 weeks. So We did our Back on Track event and have given about 75 vaccines, which was less than last year. But we also did an end of the year event in May, so I think that kind of counterbalanced. You add them both together, it was roughly about the same amount. We hired our school health liaison and she started Kayla. So she's going around all the schools, getting to know the schools, the nurses, the health aides, and kind of learning where they need help, what they need, and where we can kind of fit into that. And we got a new Helmer. I call her Big Bertha. She's a big double wide. But besides that, we're just hitting our busy season with the vaccines.
I would like to say that a few weeks ago, I called to get a vaccine. Now that I have no doctors and nobody loves me anymore, I'm out in the middle of nowhere. I got my flu and my COVID, and it went great, very quick, in and out, very nice. Down in Florida about 3 weeks ago, my wife's very healthy, but she got this cough. And she's got laying around more than usual. And after about the third day of it, I was at the grocery store and I saw a COVID test there. I thought, she's been kind of, down with a little this. My wife had COVID, turned out. And she did fine in 3 days and so forth like that. She'd had vaccines in the past, but that's kind of funny. But anyway, you staff did a great job. Medicare, I paid nothing, whether it was a gift or Medicare. but anyway, the department did a great job, and I appreciate it.
We're also in the middle of employee flu shots. The county commissioners pay for all county employees having flu shots.
I actually looked at the flu tracker today from the CDC, just in anticipation of this meeting, actually, when they have it. So, during peak COVID, we had no influenza. That was the only year ever where we didn't, because everyone stayed at home, wore masks, and, wash their hands and did things that Mama taught us years ago. Right now, Indiana has the influenza-like illness. It's called the ILI line, and it's a 2.3. That's our area of the country. So at all times, with 2.3, these tests would be positive. Doesn't matter if it's August or July or June or whatever else, it's always going to be there. So we stay below this threshold and we map it week by week. And as soon as we climb above that, you're into flu season. So this year, right now, week 43, compared to last year, we're twice as high. It's only 1% up to 2%. So we're still below the line, but the last time we were here at this time, we had an early flu season. I don't know if it'll hold, but that was 2022 and 2023. We took off in the next 6 weeks. So if you talk to people about flu vaccines, I would get it sooner than later, just because we put out another flu season. And this weird wonky weather we've had with the droughts and everything else, who knows what it's going to be like. So
what level of the flu is this? H1N1 or whatever?
Won't know that until next year about what this is halfway through when the serology comes back. So, we keep, I know ERs keep testing everybody that comes through. And, flu-like illness is starting to mount a little bit, and that's where some of these more flu tests are coming through. But percentages is a little higher than it has been in recent years. But again, we'll know more in 3 weeks probably. If it does take off, 2022 was actually a pretty bad rapid onset flu season for people.
So you being in the medical in charge officer, do you recommend if somebody had COVID infection before, get 4 COVID shots before, they still need to get a vaccination?
Yeah, absolutely recommend vaccines for everything you can get vaccinated for. The vaccination process started, ridiculous. What year was it when the whole smallpox thing with the ladies?
2004?
No, the original vaccine.
Oh, okay.
Like 1700s.
Yeah.
So,
Okay.
That's where they started talking about inoculations of viruses can help. So we're doing these boosters and everything else. You're just prepping your immune system to get ready, because vaccination is never going to protect you from coming in contact with the virus.
That's what Biden said.
So
vaccinate.
Both right presidents. President Trump got COVID and President Biden got it.
Absolutely.
Of course, they're around a lot of people
Yeah,
from all over the world, so they have a lot of exposure.
give your body a leg up on it. That's
But,
right.
just wanna let everybody know, it's not 100%. I had COVID shots. I have a lawyer's brother, had a COVID shot and been in the hospital for several months, encephalitis, another problem, still not functioning well. And then the only, reason is he had that vaccination, and whether it's due to the vaccination or he probably is getting some kind of, but the approximation of the vaccination to the development of, encephalitis was there, but they cannot pinpoint it. There are very, very, very minimal risk of vaccination. But still, the only problem right now is we're not dying of COVID as like 2-3 years ago, So it's probably just like flu shots, and as a matter of fact, they give the same, but COVID and flu. Yeah, but it's separate, I mean, it's the COVID vaccine and then flu vaccine. There is a company that the government did not approve. It's one shot, COVID and flu mixed together.
There's one caveat that we don't talk about in the general public, but it's the long COVID. And you see it more in medical journals and so forth, or something like a Scientific American or something. But long COVID is definitely a reason to get vaccinated. They said as many as 20% of people may have long-term effects from COVID, and it may be a wide range of things to be debilitating. I mean, it's a huge thing that we don't really talk about, and most literature suggests if you've gotten vaccinated, it decreases your chance of having long COVID. And you don't want long COVID. I mean, you may probably, some of you in this room know people who've had it because it's that common, have quit their job, lost their taste or smell, headache, whatever. It's a wide range of, unusual, the way it presents physically. But man, you don't want long COVID.
Yeah.
And so and I don't think we push that enough as a reason to get vaccinated. You don't want this long COVID, and you don't really read a lot about it too much in the lay press or on TV so much, but it's 20%, we're talking millions of people who are suffering from this. And if a shot would help lower that risk of long COVID, we should be promoting that idea also. Not just prevent COVID, but preventing long COVID, because that's a disaster for people.
But nobody's pushing COVID vaccination anymore in the news.
Well, we're trying here. That long COVID you do not want.
Another reason we should have live satellite coverage all across the country, county.
Yeah, that's right, absolutely.
But I
It's out
think
there.
the mere fact that you had natural immunity, once you had COVID, you had natural immunity to COVID. Is a big factor why it's not spreading as before.
But new strains and mutations, so the vaccine changes every year, just like the influenza vaccine does. And so you gotta keep on top of the new strains. And they didn't hurt me at all. So I highly recommend it.
It came from China, right?
Thank you, Shelley. All right. Andy, do you want to introduce Isaac?
Yeah, we have Isaac Hellman here, and he has been one of our data entry employees, contract employee for our Inspect to Go program. So he's had the task of entering in our 11,000 septic permits
Nice.
into a database so we can put it on the system.
Thank you. All right. Any citizen input? All right, so our next board meeting is going to be January 15th. Do I have a motion to adjourn?
Motion to adjourn.
All right, second?
Second.
All right, all those in favor?
Aye.
Opposed? All right, thank you all for your time and attention.
And I had 2 times going through. My first